On Radiology News tonight, the investigation on radiation safety with Rachel Smith, discovering the major concepts, the radiographer's role in radiation protection, and how different imaging modalities implement radiation safety. From the Radiation News headquarters, this is Radiology News Tonight with Rachel Smith. Good evening, and it's great to be with you. Our big topic tonight is radiation protection. And we begin by reporting that approximately 400 million radiologic procedures are performed every year, and this number will continue to rise with the increased use of advanced imaging modalities. Because of these advancements in imaging and the rising number of procedures, overall radiation dose has increased by approximately 6 times since the early 1980s. In order to ensure the safety of the patients who receive these exams and the radiologic technologists who perform these exams, proper radiation safety is essential for all imaging professionals to follow. We begin our investigation tonight by discussing the major concepts of safety within the radiologic practice. One of the most important principles to follow is ALARA, which is an acronym for as low as reasonably achievable. This idea is used throughout radiology to perform radiologic exams using the least amount of radiation while still using enough radiation to maintain a quality radiographic image. The next concept includes the cardinal rules of radiation protection: time, distance, and shielding. These are all used in regards to both the patient and the radiation worker. Concern for the patient should include reducing the amount of time the beam is on, using as much distance as allowed between the X-ray tube and the patient, using appropriate shielding devices. Concern for the worker should include reducing the amount of time spent in the room. For example, you spend 60 minutes in a room and are exposed to 10 Rankine. If you cut your time in half to 30 minutes, mathematically, your dose should also be cut in half, resulting in an exposure of 5 Rankine. Standing at the farthest distance from the beam as possible, using appropriate shielding devices. Now that I have gone over the major concepts, you might be wondering what the major roles of the radiographer are when focusing on radiation protection. The radiographer is expected to 1. Be educated in the safe operation of radiation-producing imaging equipment. 2. Follow established procedures. 3. Select technical exposure factors that follow the ALARA principle. And 4. Use protective devices. To shed more light on this topic, we are going to look into how the radiology department puts these concepts into action within some of the different modalities. In order to find out the information firsthand, I took my investigation to a nearby hospital and met with Sam Lopez, an expert in radiation safety. My first stop was general radiography. I finally made it here to the hospital, and I'm ready to uncover the information, leaving no stone unturned. Let's go see if Sam is ready to answer some questions. Hi Sam, I'm Rachel from Radiology News Tonight.
Hi Rachel, nice to meet you.
I hear you have some information to share with us on how you protect yourselves and your patients against radiation.
I do, let me show you. First, I will talk about how we protect the patient. One of the major items we use to protect our patient from radiation is our lead shield. Each shield has 0.25 millimeters of lead equivalent. First, I'll show you our lead shield. This shield is for when the patient is sitting or lying on the table. The next shield I'll show you is our rolling shield. And this is used for when the patient is standing at our upright bucky. Next, I'll have you sit in the chair and I'll show you some other ways that we use radiation protection. Okay, the first thing I'm going to do is I'm going to place a shield on your lap. Now I'm going to have you place your right wrist on our cassette. Another safety measure we perform is called collimation. This limits the amount of scatter radiation and focuses the beam toward the particular anatomy we are looking at. This light, it shows where the radiation will be hitting, and since a wrist is small, I will adjust the light so it only includes what we need to see in our image. Once I finish positioning my patients, technologists protect ourselves by going behind this lead wall. This wall is a radiation barrier that has 1/32 inches of lead within it. We also have this window that is lead lined that we can still see our patients while we are exposing.
Wow, that's a lot to consider.
There definitely is. The next thing I'll talk to you about is our fluoroscopy exams, which are part of our general radiography. With this, we do live action images in which we protect our patients and ourselves in a little different ways. Follow me and I'll show you to our fluor room, and I'll show you what we do.
All right, sounds good.
In fluoroscopy, the beam comes from underneath the table, and one of the ways we reduce patient dose is to turn on DigiPulse. DigiPulse reduces patient dose by giving a periodic radiation dose instead of the constant stream of beam. This concept goes along with one of the particular cardinal rules of radiation protection. This reduces the amount of time the beam is on, which is what we are trying to limit for our patients. Another way we protect our patients is by placing a shield on the table that he or she will lay on when appropriate. Collimation is another big contributor to patient safety, and we collimate by using these switches. The last thing that helps with patient safety is filtration that has been permanently added inside the machine, which removes the low energy photons from the beam. For example, these aluminum sheets will act as our filtration. The more layers you add, the thicker it becomes, the more low energy photons of the beam are absorbed. This ultimately will reduce the patient dose.
What about workers? How do they protect themselves?
Well, in fluoroscopy, we stand in the room for the entire exam. So we wear protective skirts, vests, and thyroid shields that have 0.5 millimeters of lead equivalent. Another piece of protection is the lead curtain we have hanging from our fluoral tower. And this protects us from Compton scatter radiation. This curtain contains 0.25 millimeters of lead equivalent. And scatter radiation comes from the patient as the primary source of radiation that increases technologists' dose.
Well, thank you, Sam, for sharing all this information with us on radiation safety and general radiography.
You're welcome.
Thanks, Sam. That was a lot of great information. Now we have some great ideas on how technologists are protecting their patients and themselves against radiation in general radiography and fluoroscopy. Other modalities, such as computed tomography and nuclear medicine, are not able to use the same radiation protection techniques. I took my investigation further by visiting these departments to reveal the methods that they use for radiation safety. My next stop was CT. Thanks for meeting with me again.
You're welcome. Let me start off by saying there are 6 things that allow for reduction in patient dose in CT. Isocenter and iterative reconstruction are the 2 most important ones for decreasing dose. But filtration, shielding, and clearing interfering objects are also helpful.
Can you tell us more about these?
Sure. Starting with the basics. Remember to check your scan field of view, making sure that it is free from all interfering objects. Next, when appropriate, apply a bismuth shield to the patients, which will filter out the low energy x-rays that would only increase the patient dose. The most basic and important step is to ensure that the patient is correctly positioned in isocenter. This is the point in space through which the central ray of radiation beam passes. You want to make sure you are centered in the mid-coronal plane and the mid-sagittal plane. If the patient is off-centered, this could potentially cause artifact, image degradation, and overall increase their dose. There's more that we as technologists can do in order to cut patient dose. One of the most important aspects of the computer side is the software. Dose modulation is a software that automatically adjusts MA based on the anatomy from the scout image. The scout image is the low-dose image that is taken so that dose modulation can determine MA adjustments as the beam passes through varying tissues. Iterative reconstruction is used to aid in dose reduction. If the dose is reduced too much, the noise can be presented on the image. The iterative reconstruction software is used to clean up the noise within an image, which allows us to decrease radiation by 40 to 60% while maintaining a higher quality image. If you look at these two images, the image on the right has the same quality as the one on the left, but with 50% less dose. Iterative reconstruction is fairly new, yet has a tremendous impact on dose reduction. That about sums it up with what we focus on for radiation protection in CT.
It was great to learn about how CT enforces radiation protection. My last stop in the radiology department was nuclear medicine. Let's take a look. Thanks for meeting me in nuclear medicine, Sam. I really appreciate it. So I hear that radiation protection here is a lot different than in CT and general radiography. Do you mind telling us a little bit about that?
Not at all. It is much different here in nuclear medicine. Here, we concentrate a lot on the technologist protection from radiation because we are more susceptible. So what I'm going to do is I'll give you a mock demonstration on how we protect ourselves and our patients here in Nuke Med.
All right, sounds good.
I'll be demonstrating the setup for a bone scan. First, we look at our dose chart right here. This chart indicates how many millicuries for this exam that we need to give our patient. This chart indicates that we need to give 20 to 30 millicuries for this particular procedure. Let me show you how we draw this up. This is the L shield. The L shield is used for drawing up doses and limiting the exposure to the torso, while the glass window protects the head. This is our syringe and our syringe shield. This protects technologists from the radiation while we are drawing up the patient's dose. This is called our vial shield, also known as the PIG. It holds the bulk of our radiopharmaceutical, also known as MDP. This is our dose calibrator. It measures the amount of dose drawn to make sure that we have the correct dose for our patients. Transporting radioactive material safely is another concern here in Nuke Med. One way in doing so is by placing the dose into a syringe carrier. This carrier reduces the exposure during transit to patient's room or any other location, like this. The first thing we're going to do is we're going to put our syringe in the syringe shield. And then we're going to take this into our L shield. And this is where we're going to drop our dose. Now we're going to take the syringe back out of the shield and put it in our dose calibrator. This measures to make sure that we have the correct dose for our patient. We're once again going to put the syringe back into the syringe shield. And now we're going to place this into our syringe carrier. I brought the dose to my patient. I changed my glove to make sure I keep the patient and myself protected. Now I'm going to administer the dose. And I'm going to distance myself from the patient. After giving the patient the correct dose for the bone scan, we as technologists want to make sure that we maintain a safe distance from the patients to help reduce our dose. Also, we want to make sure to limit our time around any radioactive source while mixing up the doses or being around patients after they have received their dose.
Well, thank you for having me. That was a lot of great information.
You're welcome.
For our last short segment, Sam has joined us in the studio tonight to explain one final piece of information on how radiologic technologists protect themselves against radiation. Sam, thanks for joining us.
Glad to be here. One of the things that anyone working with radiation has to wear is a radiation badge. This is also known as the personal dosimeter. The dosimeter determines our occupational exposure by detecting and measuring the quantity of ionizing radiation we have been exposed to. There are many types of dosimeters. but one of the most common types today is known as the optically stimulated luminesidometer, also known as the OSL, and it looks like this. OSLs are lightweight, durable, are easy to carry, and less susceptible to elements such as heat and moisture. During routine radiographs, they're to be worn at the front of the body at collar level. When the technologist is wearing lead apparel, the badge is to be worn on the outside of the apron at collar level on the anterior surface of the body. Now every month these badges are turned in and processed. We will receive the dose report to monitor our exposure, that way we can remain safe.
Thank you for joining us this evening. We have really learned a lot from you and appreciate all your help with discovering the world of radiation protection. We visited general radiography and learned about the use of shielding and collimation as the primary means of radiation protection. We have found out about the apparel worn in fluoroscopy, along with digipulse, the lead curtain, and collimation that also aid in radiation protection. And we also learned that the modalities computed tomography and nuclear medicine are not able to use the same safety methods. Instead, CT is focused on isocenter and iterative reconstruction as means for dose reduction. And nuclear medicine places emphasis on technologist protection when drawing up doses by using several types of lead-lined equipment and maintaining a safe distance from their patient. We both want to thank you for joining us this evening. Have a good night, and I'll see you tomorrow for another episode of Radiology News Tonight.